If someone's on antidepressants, they can't just stop. If someone's on medication, they can't just stop, unless, of course, it's aspirin or statin drugs. But mind-altering drugs, and especially the cortisones, they cannot be stopped immediately or the person will fall in a lump, because a lot of these medications are addictive. And what we have found, especially with pain-killing medication, eventually it's not doing what it first did, and now the person's addicted. And that's where these wellness retreats have an answer. Because at our health retreat, we have steam saunas, we have juicing days. And what that does is that causes the body to go into a detox, especially in the sweating. A lot of waste is sweated out. Do you know what some of that waste is? The drugs that they're addicted to.
Did you know that over 50% of medications prescribed to treat chronic illnesses might actually worsen your condition? Dr. Barbara O'Neill's groundbreaking research reveals shocking truths about the pharmaceutical industry's hidden dangers. In her compelling warning, she exposes how common medications are not only ineffective, but can contribute to a decline in health, leading to severe side effects and complications. In this eye-opening video, we will make you question everything you thought you knew about your prescriptions and their true impact on your health. Dr. Barbara O'Neill critically addresses the issue of medication overuse, emphasizing its potential to worsen rather than improve health conditions. O'Neill asserts that widespread reliance on pharmaceuticals can sometimes worsen the very conditions they aim to treat. A key concern is that many medications, especially when used for long periods or without proper oversight, can disrupt the body's natural balance. This disruption can lead to a range of secondary health issues that complicate the original ailment rather than offering true relief. For example, long-term use of painkillers, while providing temporary symptomatic relief, may mask underlying health problems. This masking effect delays the identification and treatment of root causes, allowing potentially serious conditions to progress unchecked. O'Neill also highlights the risks associated with overusing antibiotics. The use of these drugs can lead to antibiotic resistance, a significant public health threat that renders future infections more difficult to treat. This resistance not only complicates individual patient care, but also contributes to the spread of resistant bacterial strains. Similarly, the use of antidepressants and anti-anxiety medications can create a dependency that may ultimately worsen mental health conditions. Patients may experience a decrease in medication efficacy over time, combined with side effects that can intensify existing symptoms or introduce new health challenges. Additionally, the interaction between various medications can produce adverse drug reactions, further deteriorating a patient's health. Even common medications, while often essential for managing acute health conditions, can have significant long-term side effects that necessitate careful consideration. For example, long-term use of corticosteroids, such as prednisone, can lead to osteoporosis, as they interfere with bone formation and increase calcium excretion, which heightens fracture risk. This disruption in bone density may also exacerbate existing conditions like arthritis, worsening joint pain, and mobility issues. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, may contribute to weight gain and metabolic syndrome, thereby increasing the risk of type 2 diabetes and cardiovascular diseases. In addition, they can alter bone density, compounding the risk of fractures and osteoporosis. Chronic use of proton pump inhibitors, PPIs, prescribed for acid reflux, has been linked to kidney disease and an increased risk of bone fractures due to impaired calcium absorption. The disruption of stomach acid can also alter gut flora, potentially leading to chronic digestive issues and compromised immune function. Statins, commonly used to lower cholesterol, may cause muscle pain and weakness, which can progress to a more serious condition known as rhabdomyolysis, potentially leading to kidney failure.
What else has been implemented to try and reduce heart disease? Number 2, get as many people as possible over the age of 50 onto cholesterol-lowering medication. In fact, they're often called statin drugs. So we'll just call them the statins. It's easier to write. There's a Crestor and Lipitor. They're 2 common cholesterol-lowering medications. I have a book at home. It's by an astronaut, and also he's a medical doctor. And His name is Dr. Dwayne Graveline, and the title of his book is Lipitor, Thief of Memory. So he went for his yearly blood test, and the doctor said, "Oh, your cholesterol level's a little bit high. What is it?" 220. "I want to put you on cholesterol-lowering medication. It's a little bit high. We don't want you to drop dead from a heart attack." So he took the statin drug through fear.
Antihypertensives, used to control blood pressure, can result in electrolyte imbalances and renal function impairment, which may aggravate pre-existing conditions like diabetes or heart disease. Dr. O'Neill also points out that long-term use of certain antihistamines can lead to cognitive decline, particularly in the elderly, due to their anticholinergic effects that impact brain function. This cognitive decline may worsen existing neurological conditions like dementia. Medications such as metformin, used to manage diabetes, can cause vitamin B12 deficiency over time, which may lead to neuropathy and anemia. In addition, medications, particularly antibiotics and certain chronic medications, can significantly disrupt gut health by altering the gut microbiome.
Antibiotics kill bacteria, the good and the bad. What also causes a compromise of this gut flora is the contraceptive pill. Many drugs do. Cortisones and statin drugs are probably among the worst. And if the person on top of that is having a lot of refined sugar and alcohol, that feeds the yeast part.
Antibiotics indiscriminately kill both harmful and beneficial bacteria, leading to an imbalance that can persist long after the treatment has ended. This disruption can reduce the diversity and abundance of beneficial microbes, which are crucial for maintaining gut health and immune function. Chronic medications such as proton pump inhibitors and non-steroidal anti-inflammatory drugs, NSAIDs, can further compromise gut health by altering gastric acid levels and damaging the intestinal lining, which impairs digestion and nutrient absorption. A compromised gut microbiome, as Dr. O'Neill points out, can have widespread consequences on overall health. The imbalance in gut bacteria can lead to conditions such as dysbiosis, which is linked to systemic inflammation and has been associated with a range of diseases, including irritable bowel syndrome, IBS, and inflammatory bowel diseases, IBD. The gut microbiome also plays a pivotal role in the synthesis of essential vitamins and neurotransmitters. Thus, its disruption can contribute to deficiencies and mood disorders. If that's not enough, a disrupted microbiome impairs the gut's barrier function, increasing intestinal permeability or leaky gut, which allows harmful substances to enter the bloodstream and potentially trigger autoimmune responses or exacerbate chronic conditions. A lot of medications can lead to significant nutrient depletion, which negatively affects overall health. Statins, commonly prescribed for cholesterol management, have been shown to reduce levels of coenzyme Q10, CoQ10, a crucial antioxidant that supports cellular energy production and cardiovascular health.
How do the statin drugs work? They block the pathway in the liver that the liver uses to make cholesterol. But that same pathway that it uses to make cholesterol, it uses to make coenzyme Q10. What's coenzyme Q10? It's your heart protective enzyme. So you can go on statin drugs thinking that you're going to reduce your risk of heart disease, and you can actually increase it because you've now lost coenzyme Q10. Here are the side effects of the statin drugs: muscle wasting, memory loss, Alzheimer's, dementia, and they've just added another one, it's breast cancer. Because if you don't have enough cholesterol, you can't make your sex hormones correctly. The ability of your body to make them is compromised. I remember one of my favourite authors, she said, drugs never cure disease. They just change the form and location of, and can't you see it in this?
The depletion of CoQ10 can lead to muscle pain and fatigue. Diuretics, used to manage high blood pressure, often result in the loss of potassium and magnesium. Potassium depletion can cause irregular heartbeats, muscle cramps, and fatigue. while magnesium deficiency can exacerbate muscle spasms, headaches, and contribute to cardiovascular diseases. Proton pump inhibitors, PPIs, prescribed for acid reflux, can reduce the absorption of vitamin B12 by altering stomach acidity. This deficiency may lead to anemia, neuropathy, and cognitive issues. Metformin, a common medication for diabetes, can lower vitamin B12 levels, increasing the risk of anemia and neuropathy. Antidepressants, like selective serotonin reuptake inhibitors, SSRIs, may impact folate levels. They can even lead to depression and cognitive impairments due to folate's role in neurotransmitter synthesis and brain function. Certain anticonvulsants, such as phenytoin, interfere with vitamin D metabolism, affecting calcium absorption and potentially leading to osteoporosis and bone fractures. Chronic use of corticosteroids is also responsible for calcium loss, raising the risk of bone density loss and osteoporosis. But what can you do if you really want to protect your health? Dr. Barbara O'Neill says that you can opt for dietary adjustments, herbal remedies, and lifestyle changes.
The herbs come along and say, "Where would you like me? What would you like me to do?" Medicine calls it synergism, working with the needs of the body. Whereas drugs come along and say, "Get out of my way, I've got a job to do," whether you need it or not. Drugs are like robots. I must do, whether you need it or not. Yes, in a crisis, a drug can save a life. Yes, in a crisis, I was thankful for the block on my arm that I didn't feel. But that was one day, not since and not before. It's not the odd day you do it, and it's not the odd day you don't. It's what you do every day that has the effect on the body.
She recommends having a whole food, plant-based diet rich in antioxidants, which can enhance the body's detoxification processes and support overall health. According to Dr. O'Neill, this diet may reduce the risk of chronic diseases like cardiovascular issues and cancer by addressing underlying inflammation and oxidative stress. Herbal remedies, such as turmeric and ginger, are highlighted for their anti-inflammatory and antioxidant properties, which can aid in managing conditions like arthritis and digestive disorders. Dr. O'Neill also supports the use of stress management techniques, including meditation and yoga, which have been shown to lower cortisol levels and improve mental health, potentially reducing the need for pharmacological interventions for anxiety and depression. Dr. O'Neill explains that natural treatments usually have fewer side effects and a lower risk of addiction compared to conventional medications. However, they might take longer to work and their effectiveness can be less certain. Conventional medications are tested thoroughly and can provide quick relief for specific problems, but they may have side effects and long-term health risks. In addition to that, lifestyle changes can play an important part in preventing or mitigating health issues. She advocates for a balanced diet rich in whole foods, emphasizing the consumption of vegetables, fruits, lean proteins, and whole grains, while reducing processed foods high in sugars, unhealthy fats, and additives.
Hippocrates, called the father of medicine, he made a statement that's often quoted. He said, "Let food be your medicine and medicine be your food." And he did not know about the DNA. He did not know that our very food makes up our DNA.
Incorporating regular physical activity, such as brisk walking, strength training, or aerobic exercises, is essential for improving cardiovascular health, managing weight, and enhancing overall physical function. Dr. O'Neill recommends 9 hours of quality sleep per night to support metabolic health, cognitive function, and emotional stability. Stress management is another key focus. She encourages practices such as mindfulness meditation, deep breathing exercises, and engaging in hobbies that promote relaxation and mental well-being. Hydration also plays a vital role, with Dr. O'Neill suggesting a daily intake of at least 8 glasses of water to maintain bodily functions and aid in detoxification. She advises limiting alcohol consumption and avoiding smoking, both of which are linked to numerous chronic diseases. Additionally, Dr. O'Neill stresses the significance of regular health screenings and preventive care, including routine blood tests, vaccinations, and physical exams to catch potential issues early and manage health proactively. Practicing these lifestyle changes can significantly reduce the risk of chronic conditions such as diabetes, heart disease, and hypertension, and enhance quality of life and longevity. But these are not just hypothetical discussions. Dr. Barbara O'Neill highlights numerous cases where medication exacerbated health issues, illustrating the complexities of pharmacological treatments. For example, a case study revealed that a patient prescribed long-term corticosteroids for chronic inflammation developed severe osteoporosis, a known side effect of prolonged corticosteroid use. The patient's bone density deteriorated rapidly, leading to frequent fractures and a significant decline in mobility. An alternative approach involving a comprehensive lifestyle change, which included a diet rich in calcium and vitamin D, along with weight-bearing exercises, demonstrated a marked improvement in bone health. Another example concerns a patient with hypertension who was prescribed a class of antihypertensive drugs. The medication led to a range of adverse effects, including debilitating muscle cramps and significant fatigue. The patient's quality of life deteriorated, prompting a re-evaluation of their treatment regimen. By shifting to a holistic approach involving dietary modifications such as reducing sodium intake and incorporating potassium-rich foods alongside regular physical activity, the patient experienced substantial improvements in blood pressure management and overall well-being. A third case involved a patient with type 2 diabetes who faced worsening glycemic control despite adherence to a regimen of oral hypoglycemic agents. The medication resulted in unintended weight gain and subsequent insulin resistance, transitioning to a combination of lifestyle interventions, including a low-carbohydrate diet and an exercise program tailored to individual needs, led to better glycemic control and weight management, reducing the necessity for further medication adjustments.
Story of Henry, who came to our retreat. He was a retired judge. He was on many medications. He was on cholesterol-lowering medication. By the way, the side effect of that is memory loss and Alzheimer's, which I don't know anyone that wants. He also found that it took him a little while, but he got used to drinking more water. He started exercising. After 4 months, he contacted me. See, he was on blood pressure medication, blood thinning, blood cholesterol. He was on a whole range. He said after 4 months, he went back to the doctor. He'd lost 20 kilos in 4 months, so that's 40 pounds. And he also had his blood pressure taken. His blood pressure was back to normal. His blood thinning was back to normal. Everything was back to normal. So his doctor took him off the medication. He implemented the life. He took the herbs, and his doctor took him off all the medication.
Dr. O'Neill's case studies clearly point out the importance of considering alternative treatments and lifestyle modifications when medication-induced side effects compromise health, demonstrating how personalized, non-pharmacological strategies can effectively mitigate adverse outcomes. Dr. Barbara O'Neill emphasizes that to use medications safely, it's essential to work closely with your healthcare provider. Staying informed and actively participating in your treatment helps minimize risks and ensures better outcomes. Patients should initiate detailed discussions with their healthcare providers about every medication, including potential interactions, side effects, and appropriate dosages. A comprehensive understanding of each medication's purpose and effects allows for more effective management of one's health. It's essential to review and update the list of all current medications, including over-the-counter drugs and supplements, to prevent harmful interactions. Regular communication with healthcare providers helps in adjusting doses and switching medications as needed, based on evolving health conditions or adverse reactions. Patients must also be diligent about maintaining accurate and updated records of their medication regimen, including the schedule, doses, and any changes in health status. This practice aids in ensuring consistency and avoiding omissions that could lead to complications. Proactive patients should request and thoroughly review medication guides and labeling information, which provide critical details about potential side effects and interactions. Additionally, being aware of the signs of adverse reactions or inefficacy enables patients to report issues promptly, facilitating timely adjustments to their treatment plan. Employing a questioning approach with healthcare providers, such as asking about the necessity of each medication and the risks involved, empowers patients to take charge of their health management effectively. So, have you ever experienced unexpected side effects from your medication? Share your story in the comments below. And not only that, The medicine brands of the conventional medical system will never let you know the reality of their antibiotics. They have more side effects than remedial features. That's why, to protect your health, you should use natural antibiotics. To know more, just click on this video. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more insights. Stay informed and take care.